I decided to do a video in honor of PA week. So let's get into it. Hi, and welcome to A Little Vanity, where self-care comes first. So I'm a PA. Okay, I work in the emergency room. It's pretty fun. Okay. So I have some questions, some top questions that I always get asked. Okay. Number one question I get asked: what is a PA? PA stands for physician assistant. Okay? A physician assistant is a medical provider, a medical professional. As a physician assistant, you have to have at least a bachelor's degree and then go through a program, a physician assistant program. Excuse me, one thing. Okay. Before you can even think about applying to a PA program, you've got to take a certain course load. So you need at least a year of biology, a year of inorganic chemistry, a year of organic chemistry, a year of physics. So 2 semesters of each of those. And then depending on which program, you also need, some specific courses. So it's pretty much all the pre-med courses that you would need before you can apply to med school. You have to have those courses before you can apply to PA school. So that's really important if you're considering PA school. In your undergrad coursework, if you could put those classes as your electives, or if you get your bachelor's in something that requires those courses, like majoring in bio or majoring in nursing or even respiratory therapy. Then if you're just thinking about the future, if okay, you'll work as a respiratory therapist and then eventually you may want to go to med school or PA school, that's a good way to keep your options open so you could be flexible, make use of your time, and also secure that you'll have a good source of income prior to getting into PA school. Okay, that's all I wanted to say. Resume, continue. Okay. It's a rigorous program. You apply for this program through CASPA. This is a whole other story, a whole other video. But long story short, physician assistant is a medical professional and provider who is able to examine patients, order tests, diagnose, treat, prescribe medication. You work under a supervising physician. Your level of autonomy is really based on your facility, the department you work for, the attendings that you work with, and your level of experience and comfort. So you could really be independent, but legally not really. Because by definition, a physician assistant works under a supervising physician or works with a supervising physician. Okay? That's what a PA is. You could work anywhere. You could work in the ER, you could work in family medicine, primary care, OBGYN, surgery, plastics, ortho, peds. You could work anywhere. It's great. Like, possibilities are endless. What do I like about being a PA? I like the flexibility. I like being able to, decide if I want to do emergency medicine or if I want to go into OBGYN or if I want to go into any other specialty. Granted, it might be hard to get in because I don't have the experience. However, it's not impossible. I can get some training and I can just transfer over to that specialty as long as they're willing to train. So that's what I really like the most about it. Also, working in a team, that means a lot to me. You're working with a physician, with an attending. You're pretty independent, but you still have that team that you can fall back on. You can ask for guidance or just run things by someone else. Okay, and then the time frame that it takes to get into the profession, I really like that it's 2 to 3 years, depending on the program you choose. Although those 2 to 3 years could be like the worst years of your life. Why ER? I've always wanted to work in the ER because I just like the energy, the fast pace. I just like that, you know, you don't know what's coming through the door, and that excitement, you know, it's good for me. I'm a relatively calm person. So that level of excitement is great for me because I don't let it affect me. Also, I get bored very easily. So I just like that a variety of things that I could see. Some days it's just, you know, it could be repetitive depending on the season, I guess. But otherwise, for the most part, there's just a lot of different types of patients that you see. What is the best part of being in the ER? I think I've probably answered that already. Best part of working in the ER is the fast pace, the energy. You do your shift, and when you're done with your shift, you're done with your shift. You don't have to really worry about seeing that patient again. Not to say that I don't want to see patients again, but that's, you know, it's not a relationship that you form with the patient. So there's like kind of like a detachment, and I think that's good for me. I just want a turnover. I want to see new people. I want a new relationship with another patient. Short, you know, I see them. I don't want to have to keep seeing that person. Actually, I don't want to see them again because it's an emergency department. So, you know, I don't want them to have that problem and come back. I want you to hopefully take my advice and get better and follow up with your primary care provider. The worst part of the ER. Worst part of the ER is that sometimes, many times, is very busy. So you're basically seeing many patients, you know, writing a lot of notes, walking around, especially now with COVID, wearing all the garb and everything, and it's exhausting, you know, seeing all these patients. Just come here. Yeah, it's just seeing all the patients, and but it comes with the job. Like, I knew it was going to be busy in the ER. That's why I wanted it. I wanted to work. I wanted to see things. The time goes by so fast when it's busy anyway, so it's fine. Another thing is that sometimes you get frequent flyers. Well, those are the people that always come to the ER for whatever reason. There's many different reasons that they come to the ER, and it's kind of frustrating because, you know, you can't turn these people away, but then you also try to help them and they don't really follow the recommendations, and then they're back again, and you're stuck, you know, between a rock and a hard place because you can't turn them away, but you can't help them either, so you don't know what to do with them. So that makes your life harder, your job harder. It doesn't make your life harder, but it makes your job or your shift harder. And then, you know, they take up time, they take up space, and then, you know, they could delay the care of someone who actually has an emergency. So that's frustrating. Yeah. What is the worst part of being a PA? Some people believe PAs just are assistants. We're not assistants. We don't sit here and do all the work that the doctors don't want to do. That's not our role. We are our own, you know, profession. We are individuals. So I don't belong to this doctor, or, you know, we work together as a team. I don't allow anyone to make me feel less of a person or less of who I am, or that my profession is not as important or needed. You know, if you really feel that way, then maybe you should go to medical school. Wait. This is very important. Oh, let me sit down. I think this might take a little bit. All right. So there's no confusion about what I said before. PA school, med school. PA school is condensed information. Med school is much longer, obviously. So there's no way I, as a PA, would be expected to know everything that a doctor knows. Impossible. I could not. The course is condensed. I'm not arguing that I know more been a doctor. One of the reasons why I chose to be a PA is because it's shorter time frame. It's not because I thought it was easier. It's not because I was lazy. It's not because I, just, it's, what am I trying to say? Anyway, if you know that you will not be satisfied with having to sometimes present a case to an attending, or having someone question why you decided to choose this treatment over that treatment, then I would say maybe you should think a little bit longer about becoming a PA. Honestly, there's a big difference. I think really what it comes down to is knowing what you want and being honest with yourself. Just make sure whatever decision you make, you're happy with the decision, especially at the time that you make it. You have the right to change your mind. It's not uncommon that PAs go to med school after. Sometimes you get frustrated. You're tired of having to present a case to a doctor. You want to just do your thing and not have to be questioned. You're tired of doing the same amount of work, getting paid less, seeing a lot of patients. Sometimes you see a lot more patients than the attending. You're tired of being treated as if you're not smart enough because your program was less time. Those reasons are reasons why people continue and go to med school. But if you're in a good environment, you're happy where you are, you get the respect that you deserve, you should be plenty happy with being a PA. There's obviously nothing wrong with it. Okay, I think I've too much already. Yeah. Being a PA is awesome. If you're a PA and you feel that way, leave a comment, say something. I'd like to talk to you. Honestly, I really would, because it's a shame. Nobody should make you feel like your profession or your job or your role is not significant, ever. It doesn't matter what you do. You are important. You're valuable. So, yeah, so it's PA week. Very happy. Whether it was PA week or not, I would still be very happy. But I thought I would just make a video really quick. I don't even know how long this video is. It feels like it's only been 5 minutes, but yeah, if you have any questions about being a PA, or if you're thinking about being a PA, or if you're thinking about going into emergency medicine, leave a comment, let me know. I'll be happy to answer any questions. If you want more videos about being a PA, I plan to do more videos, more organized videos. Yeah, but just thank you for watching and hopefully subscribing and leaving me a comment. Appreciate it. Bye. Excuse me.